How can MRI detect early pancreatic cancer? Imagine catching a tiny tumor before it has a chance to grow and spread. Magnetic resonance imaging, or MRI, is a powerful tool that helps doctors do just that. It creates detailed images of the pancreas and nearby tissues without exposing you to harmful radiation. Because of its high resolution, MRI can spot small tumors that are only a few millimeters in size, which other imaging methods might miss. This makes it especially useful for detecting early signs of pancreatic cancer or precancerous changes. One way MRI helps is through its ability to identify precursor lesions. These are abnormal tissue changes that often come before full-blown cancer. For example, pancreatic intraepithelial neoplasia, or PANIN, is a common precursor. Advanced MRI techniques like diffusion tensor imaging can analyze tissue microstructure and detect these early changes, sometimes even before cancer develops. Detecting these lesions early can give patients a chance for intervention before the disease becomes invasive. Another specialized MRI technique, called magnetic resonance cholangiopancreatography, or MRCP, focuses on imaging the pancreatic and bile ducts. Since many early tumors develop near or within these ducts, MRCP can reveal irregularities, strictures, or blockages that might indicate early cancer or high-risk lesions. These ductal changes are often subtle but important clues for early detection. MRI also allows clinicians to observe specific features in the pancreatic tissue and ducts that are associated with early disease. Small changes in duct shape or tissue texture can suggest increased risk or the presence of early tumors. Because MRI is non-invasive and safe for repeated use, it is ideal for ongoing surveillance, especially in people with family histories or genetic predispositions to pancreatic cancer. Standardized MRI protocols, including techniques like diffusion-weighted imaging and apparent diffusion coefficient mapping, are recommended for high-risk groups. These protocols improve the ability to distinguish benign from suspicious or malignant changes, making early detection more accurate. In practical terms, MRI is especially valuable for screening and monitoring individuals at high risk. Detecting cancer early can mean better chances for surgery, which is currently the only treatment that can potentially cure pancreatic cancer. Early detection through MRI can significantly improve survival outcomes. However, it is important to remember that MRI alone cannot definitively diagnose pancreatic cancer. A biopsy is still needed to confirm the diagnosis. Also, very small early tumors can sometimes be difficult to see even with MRI, and the pancreas's deep location in the body presents some imaging challenges. That is why MRI is often used alongside other diagnostic tools and clinical assessments. In summary, MRI detects early pancreatic cancer by providing detailed images that reveal small tumors, precursor lesions, and ductal abnormalities. Advanced techniques like diffusion tensor imaging and MRCP enhance this ability, especially in people with higher risk factors. This early detection can lead to earlier treatment, which may improve the chances of successful outcomes. Always consult healthcare professionals for personalized advice and evaluation, as individual cases can vary widely.